Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-Spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session. Good morning and welcome to Radio Friends on Thursday, September the 14th. I want to introduce you to a couple of my doctor friends from the VA hospital, Dr. Satish Kalanjeri and Dr. Jeremy Johnson. Pleasure to have both of you here.
Thank you.
Truman VA Hospital. And today you wanted to talk about cardio rehabilitation?
Pulmonary rehabilitation.
Pulmonary rehabilitation. Okay, what does that mean?
Well, before we get into it, I just want to give a brief background. Last time we were here, we talked about smoking cessation, and that was important because smoking cessation or stopping smoking, has a preventative effect on several lung diseases such as lung cancer and COPD and a few other illnesses.
And when you stop smoking, your body can start to reheal itself, correct?
Within hours sometimes.
Within hours?
Sometimes, yeah. With conditions such as COPD, it can be pretty debilitating. And so we thought talking about pulmonary rehabilitation would be good for patients with chronic lung conditions who are symptomatic because this is a form of treatment modality that can reduce symptoms and improve quality of life.
Okay, so what do you do? What did it entail?
Yeah. So pulmonary rehab is a comprehensive patient, specific program with multiple different components. So it's usually performed in a hospital or a clinic setting. There are some home-based pulmonary rehab.
Do you have to be admitted to the hospital, or are you doing this as an outpatient?
No, it's usually as an outpatient. You can start maybe if you're in the hospital, like with a flare-up of COPD, you could start in the hospital. But usually it's as an outpatient. We found that ideally 2 to 3 sessions per week where you come to whatever the setting is, whether it's at the hospital or in a clinic, 2 to 3 times a week for several months. Usually 3 months is ideal.
Now, explain, what is COPD?
So this is chronic obstructive pulmonary disease, and it's where a patient develops obstruction, like asthma, but usually from cigarette smoking. And they have airflow limitation, where they have trouble getting air out in 1 second, and over time. It takes a long time to empty the lungs. Frequently, they develop mucus and have trouble with clearing mucus from their lungs. That's COPD.
So would you classify asthma as COPD, or is it one of the side effects of COPD?
No, yeah. If we talk about chronic obstructive pulmonary disease, it's actually overlap of asthma, chronic bronchitis, which is where you have lots of sputum production daily for months and years, and also emphysema. So kind of the 3, asthma, chronic bronchitis, and emphysema, fall under COPD, or chronic obstructive pulmonary disease.
Can you be cured of this?
No, you can't be cured of COPD. So that's where pulmonary rehab comes in, to try to help you live better and breathe better. And so there's education that happens about your lung disease at pulmonary rehab. There's breathing techniques where they help you develop breathing techniques that help you feel less breathless. There's also a component of education on diet, how to gain muscle mass to help your breathing. And then the big pillar of pulmonary rehab is exercise. They work with patients to develop endurance exercises to help with developing endurance, and then also some light strength training. And we found that when we do these kind of exercises, that they can help your breathing and help your quality of life.
If left untreated, can you die from COPD?
Oh, of course. Yep. COPD can be a event that can lead to death. Actually, we know that worldwide, and in the United States, COPD is about the 3rd leading cause of death after cardiovascular disease and cancer. So COPD kills, and for sure we need to be able to manage and treat COPD.
Okay. Now, with treating it, can you get back to living a normal, active life?
Well, normal active life has to be defined for an individual patient. Patients who are very symptomatic from emphysema or COPD, the goal of pulmonary rehabilitation is to get a quality of life that they are happy with. Will they be able to do things they're able to do 30, 40 years ago? Probably not. The reason is, as Dr. Johnson mentioned, this is an irreversible condition. The damage that has been done from years of cigarette smoking is permanent. What we're trying to do here is to circumvent what has happened and improve symptoms. And so by endurance exercises, by strengthening some of the breathing muscles, the goal is to improve what is called ventilation, the ability for the person to breathe, and therefore reduce the symptoms of severe shortness of breath. And then with strengthening and endurance exercises, which are the cornerstone of pulmonary rehabilitation, what they're able to do is much more than what they'd have been able to do before.
Right.
So there is an improvement in the quality of life. They're able to do more than they would do, but will they be able to run a marathon or do things that they were able to do when they were in their teens or 20s? Probably not.
But you're going to feel a whole lot better.
Yes.
And
yes,
the first step is stop smoking if you're smoking right now. Stop the smoking.
Right, and there's
Correct.
some help in pulmonary rehab with things that we talked about last time about how to help them quit smoking, and so obviously that's the cornerstone, that you've got to quit smoking.
How long does the rehab take? Will you be doing it for the rest of your life, or will you get to a point where you say, well, I'm okay, I can get back to not doing it?
I think the perfect answer you hit on, you should be doing it the rest of your life. So Medicare and other insurances will pay for 2 to 3 sessions per week for 8 weeks, 12 weeks. 12 weeks is usually kind of where you plateau. And so then after you finish a in-hospital or in-clinic setting pulmonary rehab, then they'll give you ideas of things to carry on at home, exercises to continue to do at home, nutrition to continue at home, breathing techniques to continue at home. So I think it's a lifelong commitment, because you're only going to be able to sustain the things the gains that you make, the benefits that you make.
If you keep working on it.
Yeah.
If you keep, I know exactly what you're saying there. Yeah. If people want more information on this, what can they do?
I think the key is to contact your primary provider. That would be a great place to start, because you want to look at whether your insurance company covers it and where you can go. And then you can talk to your pulmonologist. At the VA, they can contact their primary provider or the pulmonary section, and we have lots of information about pulmonary rehabilitation.
All right. Doctors, thank you so much for coming by. Satish Kalanjeri and Jeremy Johnson, always a pleasure to talk to you, and I learn something every time you're here.
Thank
All
you,
right?
Paul.
Thank you, Paul.
Something you'd like to hear, I'd love to hear from you. Drop me an email. That's pepperpmissouri.edu.